Hello, my name is Jennifer Millard, and I am an RN taking SIM 436 at American Sentinel University. And this is the video for the SIM 436 Health Assessment tool. Today is March 6th, 2021. Excuse me. The population that I am focusing on for this health assessment tool is the Hispanic immigrant population. Their lifestyles differ much more than my own. Hispanic immigrants predominantly speak Spanish, and that can interfere with daily interactions like their needs, wants, education, health. For instance, when they go to a store and they're looking for an item, they can't read the signs mostly. It's difficult to go up and ask a store worker what you need if you don't speak their language. When a Hispanic immigrant is diagnosed, or if they're even at risk for a chronic or comorbid condition, there's less resources for them to learn and for them to grab from and be able to learn more about that disease to prevent it or to manage it. Many of the Hispanic immigrants also face discrimination in the general public in the mentality that if you're here, you need to speak our language, which we know is not the proper way to treat our immigrants. They also have difficulty finding employment due to that language barrier and the lack of employees who accommodate that language barrier. The interview process, the applications, they're all mostly geared towards English speaking employees. And they often perform the more difficult and heavy labor jobs that a lot of the Americans don't want to do. They're not as well paying, and they're often in suboptimal working conditions like no air conditioning and very heavy labor. And most of them don't have any health care available to them. The way this differs from me currently, right now in the United States, of course, I live in Michigan. I speak English. I have no problems with daily interactions, and I don't hesitate to ask questions if I can't find something or if I need something, if I'm having trouble understanding something. I can read the signs, I can read the labels of the items without difficulty. I can ask a store employee who will most likely speak English and tell me exactly where to find the item. There are many resources available for me to look up, to read, and to learn about chronic or comorbid conditions. A simple internet search, magazines, educational material at the doctor's office is just a few to name. And I don't hesitate when I go to the doctor. In fact, I can easily message my doctor through their portal, and we can even do online video visits, which is not a problem for me at all. I just did one with my daughter last week. I don't face discrimination at all, so I'm not hesitant to go out into the public and afraid of that. I'm a 40-year-old white female. I've never had difficulty filling out an application for a job. I've never had difficulty with the interviews or communicating when would be a good time to interview, understanding the basics or the details of the job. And I currently consider myself very lucky because I have a salaried work from home job with full coverage health insurance. The health theme that I'm focusing on with these immigrants is hypertension. According to the CDC, the Center for Disease Prevention and Control, 2021 on their website, 44 to 45% of Hispanics are obese, and 46% of Hispanic men over 20 have hypertension, while only 20% of them under the age of 65 don't even have health insurance coverage. When you're diagnosed with obesity and hypertension, and even before you're diagnosed, if you're at risk for it, education is critical to inform patients how to best modify their lifestyle to avoid progression of the disease or the many complications that can stem from that, and even relaying the severity of the disease and what it can eventually lead to. Additionally, in a 2020 article in the American Journal of Public Health, author Jay Guadamuz and his associates noted that most undocumented immigrants lack access to jobs that offer employer-based health insurance, and they're barred from most federal and state public insurance programs. So and not only can they not find the resources, they usually don't have them available, which makes them less likely to go see a healthcare provider. Um, there is also a disproportionate number of healthcare providers that speak Spanish in America, and so it's harder to find. So the barriers are just stacked up against them if they are diagnosed with hypertension. The technology that I chose to implement for the Hispanic immigrant population is a free Spanish blood pressure tracker package. So it's going to come with a little bit of hardware. This is mostly a technology-based assignment, but with that, I would like to include a easy-to-use blood pressure cuff. And in that blood pressure cuff with that package comes an app that you would download. So you get the blood pressure cuff along with an app that you put on your phone, because as we know, most everybody, including immigrants, have access to smartphones these days. Within that app, once it's downloaded on the phone, there's an instructional video that in Spanish will teach Spanish patients how to properly take their blood pressure. That's where it would start out. And then they can track their blood pressure in that and watch changes and trends, along with some other things that I'll detail here shortly. I decided to name it SP Health, and I think that SP Health can contribute to critical thinking by helping the patient modify their behaviors according to the blood pressure results. It is color coded, so if they input a blood pressure of 192 over 100, it will be yellow. So then they know that that's kind of in a medium range and that they need to watch what they're doing. And I have an interpretation for that too. It will also have help, so it helps them identify how their blood pressure is trending. There will also be a graph built in there that can show them how their blood pressure is trending. And also built in is going to be a tab for nutritional resources with recipes and ideas for in Spanish. This whole app is in Spanish on snacks and meals, and most of them are going to be, if we consult with a Hispanic cultural dietitian to incorporate meals that are a tribute to that culture as well. And they would be low sodium. And then they'll be able to see the results if they make these changes and they're in the yellow or they're in the red in their blood pressure. They've made these changes from the app. They're eating lower sodium recipes from the app, snacking on lower sodium snacks. They can see that feedback and use that critical thinking to see, do I need to change? Can I stay where I'm at? And I think that will really help them critically think and better manage their disease. So I just have a quick demonstration of the application that I did put. I know we don't have to make one, but I thought it would be easier to demonstrate it. So this would be the opening page of the app when you first open it. It would say, Hola, por favor, registre. So we're going to look for their name, their age, and their weight, and then also have the availability for them to add their doctor's email in here so they can connect with their physician. That would be their first page and they'll register. Once they do that, this screen would pop up. It says SP Health at the top, which stands for Spanish Health. And then it says Hola, and they'll put their name in there. The app would automatically generate their name in there after they've registered. Hello, what would you like to do? And then there's a list here. We've got an instructional video for the blood pressure cuff. We have blood pressure. They push blood pressure and they can input their blood pressure. At this time, the development of the app does not have a Bluetooth. Since we're probably going to be starting off with lower funds, we're just going to have them input their blood pressure. When they do input, it will turn green, red, or yellow. So green would be 100 to 140 systolic, 50 to 80 diastolic. Yellow would be 140 to 180 over 180 to 119. And then red would be anything greater than 180 over 120. So we'll give them a visual right when they enter that blood pressure. And then we have blood pressure foods. So they can click that. And I think I have another screen that kind of shows what they would get to there. That will give them their snacks and their meal ideas that are low sodium. And then we have sending your results to the doctor. So they could push that And then with the email that they loaded in earlier, they can send their blood pressure trends to their specified doctor, who can then intervene or increase medications or monitor that with the patient. Um, there's a reminder on here, so they can set a reminder to take their blood pressure at the same time every day. I know I would probably need that, so they would click on that and set their reminder. There is blood pressure education, so kind of explaining at a sixth grade level what in Spanish, again, what high blood pressure is, and how they can modify that. And there's also going to be some little small exercises, maybe perhaps some layer development, working with another platform to pull in some easy exercises that they can do, because we all know exercise can help decrease the effects of hypertension. This is an example of a card that would come with the kit that they could put on their fridge to help them interpret their blood pressure. They've got the red, yellow, or green. If they're not able to recognize that in the app, or just kind of give them a visual reminder as they're going through their day to day, that if my blood pressure is in this range, I really need to call the doctor, which I have Lamar Doctora Rapida. And then it, kind of reminds them every day when they're doing what they're doing and what the range that they need to be in. So it will also help give them that feedback as to what looks good and what doesn't, and how can they relate that back to the interventions that they're taking. This is an example, just a quick example of like the blood pressure friendly foods page. These are going to be low salt snacks and low salt meals, and they're all hoping to be ethnic related, so that they're likely to take part in adding these to their modified diets to help control their blood pressure. And then there's also going to be a page on education for high blood pressure, describing what is high blood pressure and how to decrease their blood pressure. So my hope would be that when they go to the doctor's office, they are referred to this free app and given the kit, or when they download the app on their phone, they would get the blood pressure cuff in the mail with instructions in Spanish on how to do that. This technology makes the nurse's job easier, because it makes it easier for us as nurses to educate our patients. I think it will help us better connect and relate to our patients. I think it's easy to sometimes give up. In the hospital, we have the interpreter line that we can call, but you're often in a hurry, and there's a lot of distractions when you're trying to do that. And it helps us feel empowered to help our patients improve the health, and when they speak a different language, and to feel that you're able to do that for a patient who has a lot of barriers, I think is fulfilling as a nurse. When it can impact, the technology of the app can impact patient outcomes. As I showed you, the education is Spanish, and it's going to be tailored to the Spanish population by including ethnic foods that are usually eaten by that culture. There's ideas for interventions in Spanish for low sodium snacks, meals, and exercise ideas. And it also helps them communicate with their provider a little bit easier, because many of them are hesitant to communicate with their provider. And this not really needing a language to interpret or send blood pressures, which is a universal reading to their doctor, can help that give the patient better outcomes and recognize early when our blood pressures are trending high, and the doctor can intervene. And that is a recap of the app that I think would help our Spanish, Hispanic speaking population, again, that face so many barriers in controlling chronic disease. And this is just a small piece that might be able to help. Thank you.